Hi, and welcome to your Employee Benefits Open Enrollment. My name's Gretchen. I'm one of the brokers for your employee benefits with Tek. I'm happy to be here with you today, and all of the plans and information I'm talking about today will be on the plan year July 1st, 2024, all the way through next June 2025. So jumping right in, our agenda for the day, we're going to talk about open enrollment, what that is and why it's important for you. We'll then talk about qualifying life events and what to do if you experience one of these throughout the year. Next, I'll go over insurance vocabulary. These are key terms that will hopefully help you understand and digest your benefit summaries better. Then we'll go over the benefit options. Good news here, if you like the plan that you're on right now currently, you absolutely have the ability to renew as is. And there's also some new exciting benefits that your employer is offering. Then we'll talk about how to access your benefits. This is everything from how to find your digital ID card, searching provider networks, and even taking advantage of some of the added value products that you have access to for being a member with the carrier. I'll close with some reminders, things that will hopefully help you make the most out of your benefits throughout the year. So open enrollment, what is it? It is your annual opportunity to make changes to your benefits. So whether you want to change your enroll or waive status on a particular benefit, or maybe you just want to change the plan that you're enrolled in, or if you need to add or remove a dependent, this is the time of year to make all of those changes. Please also make sure that you review your demographic information to make sure that that's up to date. This year, open enrollment is running June 5th through June 12th, and all of the benefits that you elect during open enrollment will be effective July 1st, 2024. We are going to be using an online EASE virtual enrollment site this year, so that will make it a lot easier and remove all of that paper that you've had to fill out in previous years. So EASE online enrollment, you'll go to ktek.ease.com and you'll enter in your username and temporary password. You'll then be guided through an open enrollment site or structure process, and you'll be able to review the demographic information we have in there, update anything that is incorrect, and even enter your dependents information. After we've collected that, you'll be able to see your plan options side by side, as well as the per pay period cost to you. If you have any questions or need help enrolling, please know that we're here to help you with any type of questions or struggles that you might be having. You can schedule a one-on-one appointment virtually. We were on site on the 5th, so if you're watching this, you probably weren't there that day, so we're still available to you, and you should have links to be able to schedule with our calendar. You will sign and finalize all of your enrollments right on EASE, so no need to sign paper forms and turn those in or submit different documentation. Everything will be housed right in EASE. So qualifying life events. Outside of open enrollment, your employee benefit elections are locked into place. So it's important that you choose plans that are going to work for you and your family for the next 12 months. The exception to this is if you experience a qualifying life event, which opens up a special enrollment period for 60 days following the date of the event, allowing you to make changes outside of open enrollment. So all of the examples there, getting married or divorced, becoming a new parent, moving outside of the coverage area, or if you or your dependents lose prior coverage, these all activate a special enrollment period. Just let someone know you're going through one of these things, and we'd be more than happy to let you know what changes you're eligible to make. Quickly, insurance vocabulary, network. These are the providers, facilities, suppliers that are all contracted with your health insurance carrier. It's always going to keep your out-of-pocket costs lower to stay in network. Two types of plans, HMO and PPO. For your medical, you have the choice of HMO plans. On dental, you'll see both PPO and HMO options. HMO signifies that the member only has in-network coverage. They have to be assigned a primary care physician and obtain referrals from the specialist to see, or from their primary care to see a specialist. So on the other hand, PPO plans, members have in and out of network coverage. They don't need that primary care physician assigned, and because of that, they're able to self-refer to specialty doctors. Normally, PPOs cost more, so they have a higher premium because you have more flexibility with who and when you can be seen. And the premium is simply your monthly cost to belong to the healthcare plan. You guys are very lucky because your employer takes great care of you and covers a majority of your premium as well as your dependents. Any additional premium that you might be seeing from what plans you enrolled in will be taken out of your paycheck pre-tax. So as you're looking at your benefit summaries, you'll see copays and coinsurance. Copays are not subject to the deductible and they're a flat dollar amount. So typically you'll see copays for office visits or for lab work or even refilling your prescriptions. The other type of benefit you'll see on your benefit summary are going to be those subject to coinsurance. And this is where the insurer and the insured, meaning the insurance company, and you split the total cost of the medical service provided. So you share in the total cost of the benefit, and this is subject to the deductible. So you must first reach the deductible before the insurance is going to kick in and pay any coinsurance. So it's important to take a look at your deductible when looking at bigger benefits like hospitalization or outpatient care. Out-of-pocket maximum is the most that a member would have to pay in a calendar year for medical services. Once you reach that out-of-pocket maximum, your insurance kicks in and covers all covered benefits at 100%. It's important to note that both the deductible and the out-of-pocket maximum reset January 1st. So all of the plans run July through June, but the deductible, so as you're contributing towards your deductible or your out-of-pocket maximum, that's always going to reset at $0 January 1st. So medical benefits, we're staying with Kaiser. That is an HMO only carrier. We have silver and gold plans to choose from, and your employer covers 80% of the employee only rate and 50% of your dependent cost. So they really take care of you here. And again, any additional premium will come out of your paycheck pre-tax. Once you get logged into the Ease online portal, you'll be able to see the benefits in depth and compare the plans side by side. So Humana offers our ancillary benefits, which include dental and vision. There are two options when you're taking a look at dental. You have a dental HMO, which is voluntary through Humana. Voluntary means that you, the participant, pays 100% of the premium, but you get the advantage of having the group rate as well as it taken out of your paycheck pre-tax. This HMO plan is an in-network only plan and works on a fee schedule depending on the procedure code. The dental option is also through Humana and voluntary, but you have in and out of network coverage, so you have more choice with who you can go see to get your dental work done. It has an unlimited max, which means that it is never going to max out. If you needed all of your teeth and crowns, the plan would cover all of that. All of your preventative is covered at 100%, meaning your exam, X-rays, and preventative cleaning should not cost you anything. If you happen to need a filling or maybe an in-depth cleaning, start talking about scaling and root planing, that's covered at 80%. And any major work, so if you need a crown or maybe a bridge, that's covered at 50%. The vision, also through Humana, also voluntary, gives you an exam every 12 months, your lenses every 12 months, and a frame allowance of $150 every 2 years. So Teladoc Healthiest You, this is an additional virtual care option and is a new benefit this year. So you might be wondering, how is this different from the virtual care that I have access to through my medical plan? And where the big differences are is that you have unlimited virtual care for dermatology, primary care, and behavioral and mental health, all at a $0 copay. Your medical plan might cover primary care virtual visits at a $0 copay, but this would save you money for dermatology and for behavioral and mental health. It also has the added value of being able to schedule almost instantaneously. They really strive to provide care within 24 hours of you reaching out for an appointment. So you may be able to take care of some quick things that you need to be addressed immediately, faster than you can access them through your medical plan. Additional services, they also offer some back, neck, and spine care, as well as expert medical reviews that allows you to get a second opinion on a diagnosis that you've received. This is the best part, is that your employer is covering 100% of this premium for you and your dependents. So you'll be automatically enrolled in this plan, as well as any of your eligible dependents, all at $0 cost for you. Coupled with that $0 copay means that you're going to have access to a lot of additional support, all with nothing out of pocket. Once you complete your enrollment, you will receive a registration email sent to your email with a username and password and how to create a profile. After you've created a profile, you can search providers and schedule appointments right through the app. So accessing benefits with Kaiser, this is your medical insurance. If you have Kaiser already, hopefully you've registered at kp.org and downloaded the KP app. If you haven't, or if you're new to the carrier, definitely take advantage of that. You'll be able to see your digital ID card, search provider networks, schedule appointments, email your doctors, request prescription refills. That's another great thing about Kaiser, is that everybody is connected. Everything is all in one spot. So your providers can communicate not only between each other, but you can communicate with them with a lot of ease. They also care about your access to virtual or telehealth. They have phone and video appointments available with your primary care for situations that qualify. They also, what I love is the 24/7 care advice line. And this allows you access to a nurse any time of the day, which can be really helpful if you are having some worries in the middle of the night, or maybe you're a new parent and something is going on that you don't think is quite an emergency, but could benefit from speaking to a medical professional and setting some of your worries at ease. Kaiser gives you access to several emotional wellness apps. Calm pertains to meditation and sleep. Ginger is an emotional support coaching app. And My Strength allows you to personalize wellness programs. They also provide a free trial to ClassPass with a 20% off of their monthly packages. This program, ClassPass, allows you to choose the level of package that you want to enroll in. That will give you a different amount of credits that you can use to take fitness and wellness classes around town, as well as get massage therapy and even some nail or pedicures, manicures. So you can use those points differently each month and allow you to try a lot of different type of classes and wellness. So some reminders: preventative care, please go in annually to get your preventative care. It is free. There's no copay for these services. And you can go in annually to get that exam, all of your blood work, urine, mammogram, pap smear, and all at zero cost. Prescription drugs, if you happen to fill something on a monthly basis, or maybe you get prescribed something short term, always ask for generic. That'll keep your out of pocket costs lower. Additionally, always research your prescription and dosage on goodrx.com. This website allows you to see the different contracted rates at the different pharmacies, so you know where you can get the prescription the cheapest. They even have coupons and some saver cards on there that might allow you to get your prescription cheaper than if you were to go through your insurance. You may see a lot of $0 generic drugs from Walmart, as well as the lowest contracted rate a lot of times is with Kaiser. Know that you don't need a Kaiser membership to take advantage of their pharmacy features. If this is your first time enrolling, please be mindful of any appointments you have the first week where your benefits are effective, and be mindful to refill any prescriptions that you'll need towards the beginning of the month. If this applies to you and you know you're going to be kind of running close to that or have appointments the first month, please reach out and we can do our best to get you your member ID faster than it'll take for the physical card to come in the mail. We are available to help you with any provider searches. So whether it be medical, dental, or vision, we are here for you guys to help to make sure that you're staying in network and keeping your out-of-pocket cost as low as possible. And remember, we are happy to meet with any of you with individual meetings virtually. Please bring your benefit questions to those appointments, and we look forward to meeting you. So thank you so much. I appreciate your time today, and we'll talk to you soon.